All right, today we're diving into the world of clinical neurology, but we're not just going to look at it from a textbook. No, we're going to approach this like detectives on a case. A case where the crime scene is the human brain itself, and every single symptom is a potential clue.
So picture this. A patient is rushed in. Maybe they can't speak. Maybe one side of their body has gone weak. The brain is clearly in crisis, and the clock is ticking fast. This is more than just a medical problem. It's a mystery. And you have to solve it right now. So where on earth do you even start?
Well, you start with the first and most important rule in the neurology playbook, localization. This is everything. Before you can even begin to ask what's wrong, is it a stroke, a tumor, an infection, you first have to figure out where the problem is. Is it in the cortex, the brainstem, the cerebellum? It's all about where, then why. Every test you order, every move you make, it all flows from that one fundamental question.
Okay, so once we think we know the location, we need to actually see what's going on. And that brings us to our first set of forensic tools, neuroimaging. And believe me, the first choice you make here is one of the most critical in all of emergency medicine.
Because here's the big, urgent question we have to answer, like yesterday. Are we looking at a bleed or a block? Is there blood somewhere it shouldn't be? Because an acute hemorrhage needs a totally different treatment plan than a stroke caused by a blockage. And getting that call wrong, well, that can be absolutely catastrophic.
And that leads us to our two main workhorses, the CT scan and the MRI. It's really a classic trade-off. Think of the CT scan as your emergency tool. It is all about speed, speed, speed. It's fantastic for spotting a fresh bleed in a hurry. The MRI, on the other hand, that's your master of detail. It gives you these unbelievably clear pictures of the brain's soft tissue, but the catch is it takes a lot longer.
So it's all about picking the right tool for the job at hand. If you suspect a bleed, maybe after some head trauma, you are getting a CT, period. But if you're hunting for the subtle, early signs of a stroke, a blockage, or changes from something like multiple sclerosis, then the MRI is your absolute gold standard. That level of detail it gives you for soft tissue is just unmatched.
But what if the scans come back and the brain structure looks, well, normal? Sometimes the problem isn't a structural one you can see. Sometimes it's an electrical problem, and you can't see electricity on a CT or an MRI. For that, you need a totally different kind of tool, one that lets us essentially eavesdrop on the brain's private conversations.
And that tool is the EEG, an electroencephalogram. The best way to think about it is like we're listening in on the brain's electrical chatter. We're not taking a picture, we're recording the brainwaves, searching for weird patterns. Are the signals too fast, too slow? Are they firing off in these big synchronized bursts that might signal a seizure? So when do we actually use an EEG? Well, there are a few key situations. The big one is epilepsy. An EEG can actually capture a seizure's electrical signature as it's happening. It's also super important when a patient is in a state of confusion or altered consciousness, what we call encephalopathy, to help figure out the cause. And in the most serious cases, an EEG is a key part of the process to officially confirm brain death. Okay, our investigation is about to take another turn. So far, we've looked at the brain's structure with imaging, and we've listened to its electrical function with an EEG. But there is one more place we can look for clues: the fluid that bathes the entire central nervous system.
This is the exact question that leads us to a lumbar puncture, otherwise known as a spinal tap. The cerebrospinal fluid, or CSF, is amazing because it's in direct contact with the brain and spinal cord. So analyzing it is kind of like getting a liquid sample of the entire environment. It can tell us about infection, inflammation, even bleeding.
And we're not just fishing for clues, we're looking for really specific things. If we're worried about meningitis, we're looking for evidence of infection, like bacteria or white blood cells. If we think there might be a bleed that the CT scan missed, the CSF will show us the chemical leftovers of old blood. And for diseases like MS, we're hunting for very specific inflammatory markers that tell us the body's own immune system might be on the attack. So we have all of these incredible, powerful investigative tools, but none of them can be used without a strict ethical code. Because we always have to remember our subject isn't just a puzzle to be solved, it's a person who needs our protection.
This quote really just says it all, doesn't it? In our hunt for a diagnosis, we can't ever lose sight of the fact that our number one job is to protect the patient. And this becomes even more true when their illness might be affecting their ability to make decisions for themselves.
So, how do we protect them? Well, it all rests on these two non-negotiable pillars:
First, we have to assess their capacity. Can this patient actually understand what we're proposing? Can they weigh the pros and cons and make a decision? If the answer is yes, fantastic. Then we move to the second pillar, informed consent. And this is so much more than a signature on a piece of paper. It's a real conversation about the risks, the benefits, and any other options they have.
And for neurologists, this is absolutely crucial. Think about it. Conditions like dementia, or even just confusion from an infection, can directly impact a patient's ability to consent. In those moments, our duty to protect them, to act in their best interest, becomes the single most important part of the entire investigation.
So, as you can see, a neurological diagnosis isn't just a lucky guess. It is a careful, logical, and deeply ethical investigation. It starts with finding the location, uses all this amazing technology to look at structure and function, and is guided every step of the way by a powerful ethical code. But it makes you wonder, right? Thinking about the brain this way as a complex mystery that we can systematically solve, how does that change the way we see the incredible machine inside all of our heads? It's something to think about.